Type 2 diabetes treatment NICE. Although NICE guidelines only apply within England, Wales and Northern Ireland, they are widely studied across the English-speaking world and generally maintain a high reputation. NICE guideline development groups are made up of practising clinicians and academics, health economists and patient representatives, which allows for the sometimes conflicting priorities of each interest group to be brought together alongside the best available evidence to produce an authoritative guideline to best practice. Guidelines. Originally expected in June 2015, but delayed by considerable revisions. The updated NICE guidelines for the management of type 2 diabetes in adults were published in December 2015 and replaced Clinical Guidelines 87. Some readers may remember that CG 87 was itself a swift revision of CG 66 because of the frequent drug launches at the time. When considering the requirements of guidelines in general, we would expect them to be clear, credible, practical, consistent, and, ideally, resistant to the need for revision for a reasonable length of time. It is also important to realize the scope of NICE guidelines for diabetes care in particular. The updated Type 2 diabetes guidance known as NICE Guideline 28 deals with the management of type 2 diabetes in adults. It does not include diabetes diagnosis, as this is covered elsewhere, but it does cross-reference to other guidelines on the management of cardiovascular disease, hypertension, and lipids and chronic kidney disease. There are also specific NICE guidelines that focus on the management of type 1 diabetes, diabetes in pregnancy, and diabetes in children and adolescents. Why do we have a new guideline? Since the publication of CG 87, probably the most significant developments in the clinical management of type 2 diabetes in primary care relate to an increasing familiarity with new classes of both oral and injectable medications. There has also been a progressive accumulation of evidence regarding type 2 diabetes management to be taken into account. For example, the update clarifies the recommendations regarding the use of antiplatelet agents aspirin and clopidogrel for primary prevention of cardiovascular disease, i.e., do not offer antiplatelet therapy for adults with type 2 diabetes who do not have cardiovascular disease. And it also addresses concerns around the risks of hypoglycemia associated with some treatments. History of NG28. Before its final publication, NG28 was published in draft in January and June 2015. Both drafts were widely criticized by the Primary Care Diabetes Society and other stakeholder organizations. In particular, clinicians criticized the prominence afforded to repaglinide, a drug of the meglitinide group, which will be familiar to few practitioners in primary care. Repaglinide works as a short-acting insulin secretagogue, a short-acting version of a sulfonylurea, first produced in the 1990s as Novanorm. It never achieved widespread usage in the UK, perhaps because it was thought to offer insufficient benefit to justify its price premium against sulfonylureas. Now the drug is off-patent and inexpensive, and its inclusion in the draft guideline was most likely a response to the widespread increase in awareness of the dangers of hypoglycemia. Whilst particularly related to the use of insulin, hypoglycemia is also an important possibility with sulfonylurea usage. A shorter-acting insulin secretagogue, such as repaglinide, might be expected to be a safer option than a sulfonylurea, but the PCDS and others protested that it was impractical to include such a relatively obscure drug as a mainstay of the guideline, and also that the evidence base for its effectiveness and safety is relatively poor. It might also be noted that the permanent inclusion of repaglinide would leave the NICE guideline significantly out of step with other international guidance, such as those from the Scottish Intercollegiate Guidelines Network in Scotland, the European Association for the Study of Diabetes, and American Diabetes Association. To their great credit, NICE took these points and others on board, and the final version of NG28, whilst inevitably not satisfying all opinion holders, should be widely supported and followed. Want to know how diabetes, exercise, and nutrition come together? Let me share with you all I know. Click the link in the description for a free, just released report about this. Take action now by clicking the link below.